So now we're going to talk about the social ecological model and behavioral change. Because remember, we don't live in a bubble by ourselves as individuals. We have relationships with people. We live within a community and we live in an entire governmental societal structure. So all at every single level of society, we are impacted. And so we call this the social ecological model, which really what it does is it helps us understand the multiple levels of influence on health and well being, how society, community, or relationships impact us as individuals. And the center of the model is the individual, right? Because all those things ultimately impact the individual. And so there's four different levels. There's the individual level, the interpersonal level slash relationship level, community level, and the societal slash policy level. And so it's really important that CHWs understand how how to use a socio-ecological model when trying to create intervention or prevention strategies and really trying to empower their community because like I said, behavioral change or behavior as a whole is influenced by external factors as well. It's not just solely an individual just can do. An individual can't do if they don't have access to certain resources. So it's important to really understand how how the different influences of society impact the individual, and then also thinking about, at what level can a CHW make its impact? So if we're looking at the individual level, that's really focused on knowledge, motivation, and past experiences. And to personal level, that's really focuses on, getting the family and friends and social networks to be supportive. And if we're looking at the community, then looking at how can we get neighborhood schools, work environments also to be supportive or create some type of programming in order to impact the individual. Also to society, might have to do some advocacy in order to change some policies, media, also looking at cultural norms as well, that also could be influencing the individual as well. So when we are trying to design behavioral change interventions, we have to consider all the different levels of society, which we call that the social ecological model. And so at the individual level, the goal is to increase health literacy and empower individuals to make informed choices. So this is working one-on-one with someone, right? You're trying to empower them, you're trying to help them to develop the knowledge necessary. So really looking at how do we change people's knowledge, skills, and attitudes. We also look back at that health belief model and really trying to say, okay, how can we change the individual's belief about health in order for them to create those changes that are required for them to get that everlasting behavioral change. So some of the strategies might look at education, so educating individuals about the health risks and benefits. Also might look at the use of motivational interviewing to assess readiness to change and support goal setting. Motivational interviewing is a client-centered counseling approach that helps individuals explore and resolve uncertainty about behavioral change. It is designed to enhance motivation by fostering a collaborative and non-judgmental conversation. So really trying to understand like what are the clients' understandings about their health? What would they want to accomplish? What are some perceived barriers that they may perceive? And so, really, it's a listen so that the CHW could potentially provide solution. A part of this individual level is also trying to address personal barriers, which could be something as simple as someone's fear, misinformation, or their low efficacy, right? Their belief that they can't do. Um, Also, too, there might be some type of cultural barriers as far as, um, you know, uh, unable to understand information, so low health literacy. So, mainly provide materials that are within the native language of the client. So, for example, a CHW working with a person with hypertension educates them on how reducing salt intake and regular exercise can improve their condition. Looking at the interpersonal level, this is focused on family, friends, and social networks. And so the goal is to leverage social supports to reinforce healthy behaviors. So sometimes the individual it's not just on them, it's maybe their household or who they're hanging out with. So really trying to understand how can we get the family members, the friends, and support groups on board to help create the behavioral change. Some of those things might simply be if you can't really focus on the family and the friends, etc., maybe go ahead and match the individual with some peer mentoring, right? Provide them with a role model that could help them, providing them with support groups, right? Workshops, expose them to workshops, support groups, etc., that can help them to create a more positive mentality as well as create those behavioral change. Also, too, might have to sit down and talk to the individual about cultural beliefs, right? And really to understand, what are your cultural norms, right? And then how are some of those cultural norms impacting or influence your behavior for the good or the worse? And so we have to be able to break apart of some of those cultural norms, and that may be causing them, to not be healthy. So a CHW helps a smoke cessation client by involving their family in creating a smoke-free home and providing encouragement. So at the community level, this is really modifying the environment to make healthier behavior choices easier for an individual. So this could be something as simply organizing a community health program, maybe doing like a walking group or something along those lines, providing or creating a farmers market opportunity within the community, and maybe also working with schools and workplace to support or to promote health initiatives, advocating for safe public spaces to encourage physical activity, and also address local barriers like food deserts or lack of transportation. So example is a CHW working in an urban area with a high obesity rates, partners with local schools to implement nutrition educational programs and create safe exercise spaces. And then lastly is looking at the societal level. So really focusing on how do we change rules, laws, regulation, and policy? Because at the end of the day, if we could change the rules, laws, regulation, and policies, then it doesn't give a person an opportunity to do a negative behavior, right? So that's all with public health, that's primordial prevention, where we change the rules, laws, regulations, and therefore, if you do a negative behavior, there's consequences. But also to some rules, laws, regulation, policies, which we call systemic problems, are forcing people to act a certain way. So we have to look at that and like, well, this is how the policy are set up. We need to change that so that people are able to make healthier decisions and choices. So, with societal level, is to advocate for structural changes that improve public health. Structural changes refer to systemic modification of policy environments and institutions that improve health, equity, and quality of life for communities. Unlike individual behavioral changes, structural changes address root causes of health disparities and create long term sustainable solutions. So, this could be a CHW who's advocating for public health policies, educating policymakers on the community needs, assist in implementing health programs, and then also address social determinants of health as well. So example is a CHW working in a low income community with high asthma rates, joins local advocacy groups to push for air quality regulation and improve access to healthcare.